Many doctors know they overtreat their patients. In fact, in a recent survey that was taken, 42% admitted that they believed they practiced too aggressively, using too many drugs and technologies. Let's look at the history of what's happened in medicine that led to that. It was about 20 years ago, a little bit more than that, when there was a shift towards private practice, which most doctors had, to forming big organizations, HMOs, and hospitals were buying up doctors' practices at the speed of light. And today there are only a few doctors that practice outside the system. So they're stuck by the rules that are offered by the hospitals, the insurance companies, and those that are in relationship with it. So consequently, there's a system that makes a great return on investment when we use a lot of drugs, we use a lot of technologies, and we are forced to do that because that's what's expected by the HMOs that employ us as doctors. So it's a system that's built in to use more in the way of expensive approaches that will drive the cost of healthcare up. We're not trying to drive it down, we're trying to drive it up. Because the return on investment then for the people who are in big pharma, who are in the insurance industry, for those that are in the hospital system, as most doctors now are, that's what makes return on investment. So doctors now feel like they have to practice by the local standards of the community. If they don't, their medical boards get after them, their local peers will get after them, the hospitals will get after them, and they may lose their malpractice coverage. So it's not something that's an easy thing to escape. And now that we're in that situation, what do we do? When you're worried about the malpractice concerns because the standard of practice says you must use these drugs to treat those problems, you don't do that, you're on your own. You have a certain amount of flexibility to practice the way that you want, so long as you don't try to dissuade your patient from the conventional practices, and so long as nothing goes wrong with the treatment that you're offering, particularly if it's using less in the way of conventional approaches. There's also the performance assessments that are given by HMOs and by hospitals that say you're not living up to the standards of this organization and we expect you to practice in that way. And so once again, they're in a position of overtreating, doing too many things in an effort to try and get people out of the hospital and home. And lastly, we don't have enough time. We don't have time to educate our patients. We don't have time to explain all the side effects and complications. We don't have time to talk about other alternatives that might involve lifestyle and the things that we can do to maintain a healthy diet and exercise, stress reduction, sleep, and whatever else might help us with our life in a natural way. MDs are actually paid more if they do more, and they're exposed to legal punishment if they do less a lot of the time. Try not doing a workup on a certain kind of problem because you think the odds are pretty low that it's going to find something that's serious. Something goes wrong, you're in big trouble. Well, you should have done the test. That's what it's there for. Again, driving up costs. So the personal nature of the physician's role in managing patients has been taken away for the most part. I saw this coming in the late 80s, and in the early 90s at my local hospital I gave a talk on this. And people were really excited about it because they could see it. But the pressure of the HMO organizations and the hospital and big pharma and the insurance industry is way bigger than the medical profession, so we simply collapsed. And now we're in a situation where we know we're doing the wrong things and we don't see a way out of it. So medicine has become a business. It is not what it used to be 50 years ago, when it was about being with our patients, about supporting them, about listening to them and caring about them, and working through treatment protocols that are made just for that particular patient. And we have some systems that are unbelievable. They're organized just towards return on investment. I'll give you an example. I've been having a problem with a hip over about the last year, and I had it resurfaced in October of 2010. Well, 11 months later, I've got pain in that hip, and it looks like there could be an infection there. So my orthopedist said, well, let's get a joint aspiration. So I said, well, go ahead, let's just do that. Just put a needle and take it out. And he said, oh, no, we do that in the joint aspiration center now, where they're doing all kinds of injections. It's like a pain management center where they do aspirations as well. So I come into this very beautiful building that's big, that's got wonderful environment there. I'm put into a robe, an IV is started, I'm put into a gurney. They ask me if I'd like to have a little sedation, a little general anesthetic to make me feel better. And I'm going, what? A little general anesthetic to do a joint aspiration in a joint that's made out of metal that won't even hurt? Hello? So I refuse that, and then I'm taken over to a place where they put an expensive fluoroscopy unit there where they can see exactly where that needle is going. Nice and convenient. And then after that, I'm watched for a while as they take out the IV, give me my clothes back, and back to my room. Now, 20 years ago, my orthopedist would have put a needle in the joint, aspirated out the fluid, sent it to the lab, and it would have been done in about 10 minutes. I'll bet this is more than $5,000. So we're talking about the business of medicine, and this is an example of how that gets out of hand and return on investment becomes the big thing. And the doctors who are involved with this process are happy with the money, and so they're not complaining. They know that it's overkill, but they're doing it anyway. And that's how medicine has gone. So we know we're doing too much. We're in a position where we need a new model for healthcare. We need to get away from the HMO model. Doctors need to rebel and maybe do something on their own to set up their own standards of practice, because let's face it, MDs could stop HMO medicine in about one day just by saying no.